Hi, everybody, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Herb Karpatkin, who will be spending the next hour with us and answering all your questions about physical therapy and MS. Now I'm delighted to introduce him. Dr. Karpatkin's received his master's degree in physical therapy from Boston University and a doctorate in neurology from Rocky Mountain University. He's board certified in neurology and geriatrics and is certified multiple sclerosis is a certified multiple sclerosis clinical specialist. In addition to continuing to be actively involved in patient care, he's also a tenured associate professor of physical therapy at Hunter College City University of New York. Dr. Karpatkin, I'm so pleased to have you here again this month. I know you do it every other month for us, and we love it. I'd like to give everybody just a little refresher as to how to submit their questions before we start. So if you do have a question, we'd like to keep them into our Q&A area at the bottom of the app. And if you'd like to ask your question anonymously, you can. You can also ask your question live by clicking the raise hand button at the bottom. And if you're on the phone, you can just hit *9. So once again, I'll be able to unmute you if you do that, and we'll go from there. So let's see if we already have any questions. And so we do have a lady who wrote something in, and because she's going to be leaving, she won't be able to stay the entire hour. We want to do hers first.
Of course.
And this is from Renata. She said that she's having spasticity in her neck and trunk area. It's pretty painful and tight. What are some good exercises or stretches to combat that? And also, she's interested in getting a foam roller, but wanted to see what type she should get. Do you have anything that you could suggest?
Well, first of all, spasticity in the neck is not a typical symptom for MS. And so I'm wondering if it's truly spasticity or just muscle tightness. However, for the purposes of that question, it doesn't really matter. The key to stretching is to figure out in which direction you feel the tightest in, and you have to go pull away from that direction. So say, for example, I feel tightness on the right side of my neck. I would then try to bring my left ear closer to my left shoulder to make that side of my neck get more stretched out. If I feel tightness, say, in the front of my neck, which a lot of people with MS do, I have to stretch that area out, and I do that by looking at the ceiling. If I feel tightness in the back of my neck, I stretch that out by looking down at the floor. So it's going to depend to a large extent on how you are experiencing the tightness. But whatever position you're feeling the tightness in, you have to stretch in the opposite direction. The other thing about stretching, which is very important and a mistake a lot of people with MS make, is you're much better off stretching a gentle amount for a long period of time than a big hard stretch for just a few seconds. If you really want to relax the muscle, you need a gentle stretch, just maybe a couple millimeters into the pain, and then you hold it for 30, 40 seconds at a time.
Good answer. Elizabeth is asking what exercises she can do to decrease her ankle from rolling outward. Supinating? I think that's,
Yeah,
yeah.
supinating is rolling inward. So,
Well,
and
she does have a
pronating,
tendency. I'm sorry, I didn't finish the rest, but I wanted you to have the whole picture. She
okay,
said, I have a tendency to walk on the outer side of my feet, the worst affected leg.
okay. So the outer side, so that would be supinating. Okay. Um, uh, Again, it's kind of hard to figure out without getting more information. Um, if you can move your foot into the opposite position, meaning pronate. Okay. So If you feel like your foot is being pulled into a supinated position, meaning it's rolling inward, you have to exercise to bring your foot in the opposite position, both when your foot is in the air and when you're standing. Okay. And so if the problem is that your foot is tight in and weak into that position, similar to the previous question, you have to move your foot into the opposite position. So you have to practice trying to get more weight on the inside of your foot when you walk, and try to move your foot to the outside when it's in the air.
Okay. And Laura would like to know I'm sorry, not Laura, but someone has asked, how often do I need to do my PT homework when I see my PT once a week?
Oh, I love this question. Every day. Every day. This is like brushing your teeth. This is like washing your face. This is like taking your medication every day. You have to think of your exercise like medication. If you don't take your medication, the medication will not have its effect. Exercise works the same way. Okay. I have so many patients who I see who literally control their MS with exercise. They don't cure it. Exercise won't cure MS, but a lot of the problems with mobility that they have because of MS, they keep it under control with daily specific exercises. So every day, no days off ever.
Can't
Try
wait
to
to
make
tell
as I
my
can.
my sister-in-law Marlene broke her wrist and she is a physical therapist. And I have never seen anybody do so much physical therapy on themselves all day, all night. She said she wakes up in the middle of the night to go to the bathroom and she's still massaging. She's still doing so, and she healed beautifully because of it. So I'm going to tell her you said she did the right thing.
Our bodies were made to move.
Yes.
If you stop moving, your body stops moving, and your body gets very used to not moving. So movement is the key.
Yep. So Laura said that you've said if you want to get better at walking, you have to practice walking. Here we go.
Certainly said that.
For those of us who are heat sensitive and want to get better at walking when it's warm outside, do we have to practice walking in warmer temperatures?
No, the answer to that is mostly no. But if in reality you live in a warmer climate, you are going to have to build up some tolerance for that. However, there are some ways around that, and the easiest one is to spend a few dollars on getting some cooling garments. Okay, a cooling vest, a cooling cap, a cooling neck wrap. Okay. Um, I'm on the verge, hopefully, of publishing a big paper and about to publish a second one on how much just simply wearing a cooling vest can prevent the buildup of heat and improve walking and balance. I happen to know that there's this absolutely phenomenal organization called the Multiple Sclerosis Foundation, which has a free cooling vest program. And it mystifies me why more people with MS don't take advantage of that. It's one of the best deals in town.
Yep.
And I and my research has shown very clearly that if you wear a cooling vest with MS, you will walk better than if you don't. If you wear a cooling vest with MS, your balance will be less impaired than if you don't. This isn't maybe, this isn't sort of, this is a sure thing. This is a slam dunk. So I urge everyone to take care of that. But to get back to the original question, because that is a question I've asked myself, does it make sense to do some training in the heat? Probably a little bit. If you live in, Tempe, Arizona, and it's 110 degrees, no. But uh, if it's better to try doing some walking in warmer temperature than not walk at all.
Thank you. Laura says that there are many forms of fatigue. She doesn't have the typical type, but rather a motor fatigue where she just can't sustain activity. like a stationary bike very long. Within 2 minutes, it seems like she's going as hard as initially, but not generating as much power. Do you have any ideas about that? And isn't
Absolutely. I'm so glad you
isn't
asked.
she says,
This is one of the,
isn't that I get hot in that much time, muscles just start to fail.
yep. I'm so glad you asked. This is a major topic of my research. Um, there, there's no typical MS fatigue. There is the subjective perception of fatigue, which
Hmm.
is what you might have thought as being typical. And then there is motor fatigue or objective fatigue, which is exactly what you're describing that you have. It is a slow decrement of physical performance over time. And what you're describing on the stationary bike is textbook for that. So I am very happy that I can give you some advice on how to treat that and how to improve that. And the answer to that is very simply take breaks. So in one of the first studies that I published, I took people with MS and I had them walk for 6 minutes without a break. And then a week later, I had them do it again, but they walked for 2 minutes and then rested for 2 minutes. Walk for 2 minutes, rested for 2 minutes, walk for 2 minutes, etc. The group, when they took breaks, they walked literally hundreds of feet further. Okay. In another study that's a little bit more recent, we had subjects walk in two conditions, either as far as they could without taking a break, or as far as they could with taking breaks. Some of the subjects who, when they didn't take breaks, couldn't go more than 8, 9, or 10 minutes. These same subjects, when they did take breaks, would go as long as 20 to 30 minutes. So you said it wasn't heat. It actually is, even though you may not be feeling hot. The exercise increases the core temperature, particularly the temperature in your central nervous system. Once that temperature increases, the conduction through the demyelinated nerves decreases. So by taking that break, your core temperature lowers, the temperature of your central nervous system lowers, and better transmission through the nerves occur. So if you want to do more work on the stationary bike, give up on the idea of going without a break. Instead, do 1 minute on, 1 minute off, 1 minute on, 1 minute off. And you'll be surprised how much longer you can go. And as a result, how much fitter you get.
Thank you. I'm not sure, I don't remember when you answered the first question, did you address the recommendation about the foam rollers? I don't
Oh,
think
I did
so.
not, no. Um, I'm not a big user of foam rollers. If you're going to be doing it on the neck, it should be a pretty small one and a pretty soft one because you tend to be right on bone instead of muscle. Um, I know many people who swear by them, uh, uh, but I'm, as a PT and as a scientist, I'm not terribly convinced that they do what they claim to do. I don't think there's any harm in using them. Um, uh, some of my patients use them and they say they like them, but I don't see them improving as a result of it. That being said, there's no harm in trying.
Thank you. Someone said that they were diagnosed in September with MS, mostly leg weakness, some balance issues, slumped posture. Their understanding is that treatment with an anti-CD20 will hopefully stop the progression of symptoms, but how much of the original function strength will this person be able to recover?
I'm not sure what you mean by an anti-CD20, um, but that doesn't matter. How much should you be able to regain? Well, it's going to depend on a lot of things, particularly your age. But um, in terms of basic function, if you really work on the exercises, you should be able to regain most of it, if not all of it. But you'll have to maintain, you have to you have to undergo therapy with someone who knows multiple sclerosis and you'll have to keep it up. It's not like you have a few weeks of PT and it's gone. This is going to be a long-term commitment. The earlier you start an exercise program in MS, meaning the earlier after initial diagnosis, the bigger an impact it's going to have. So very often people don't get referred for PT until they've had MS for many, many years. And that's unfortunate because we can't really, by that point, there's been a lot of damage. So the sooner you start, the better. And the more aggressively you start, the better.
Thank you. Vera says that when she wakes up, she gets leg cramps. This happens immediately as soon as she wakes up. Her legs get stiff and get cramps from her calves to her toes. She says, I cannot do anything until the cramp subsides. How can I combat this? I appreciate your help.
Sure. That's not an uncommon thing that I hear. So there's two things that I recommend. One is stretching your calves right before you get into bed. Okay. And the other thing is stretching your calves in the morning when you wake up before you get out of bed. What I learned from one of my patients, what she does is this. She keeps a strap right next to her bedside. And when she gets up, while she's lying down, she gets the strap, throws it over the calf muscles, gives them a long, gentle stretch. And she said she almost never has that problem now.
Incredible. So Laura is asking if she has pain in her right hip, which is the main pain. It's already been replaced, but even 7 years ago, 7 years later, she still has pain from standing very long, much less walking. Like it is hip drop now. The joint is now smooth, but it feels like she drags her foot forward.
Well, the joint replacement is great, but the joint replacement is done mostly to reduce pain. It won't improve strength in any way. So when I hear a hip drop, um, which is, we have PTs have many ways of describing that. Um, but it makes me think that your hip muscles are really weak. And there's lots of muscles. You have four sides to your hip: anterior, posterior, medial, and lateral. And there's specific muscles in each one of those quadrants. And weakness in really any one of them can lead to dragging of the hip during gait at some part of gait. So without knowing more, I don't really know, but I think you need to find a PT who can measure the strength in your hip and give you a program to address that weakness.
Thank you. Beth would like to know if you have any suggestions for loosening tight hamstrings.
Loosening tight hamstrings, $1 million question. Um, well, that I could talk for hours on that. The first thing that's coming to mind is sit down less, because sitting tight shortens your hamstrings. Okay. Next, start start stretching the hamstrings out, but again, rather than a really long, short, intense stretch, do a really long, gentle stretch. So the one that I do, I'm a professor, so I sit behind a desk for a lot of the day. And what I'll do is while I'm sitting in my desk, I'll scoot forward in my chair, straighten my legs all the way out so my knees are straight, and then lean forward a little bit just so I feel a little bit of pulling on my hamstring muscles. Okay. And I try to make sure I do that for 30 or 40 seconds every hour or so. But the main thing is to avoid being in prolonged situations where where your hamstrings are short, like sitting.
Hmm, good suggestions. Joe says that his PT wants him to come in and use the equipment whenever he can, and every other month have an appointment to check in. Is that normal? Because he wants him to do this because there's really nothing that's healing.
um, I don't know what equipment what equipment they have. Um, Certainly coming in and using the equipment to keep yourself fit is a good idea. Whether it will improve your overall function, I don't know. I have a strong visceral response to a PT saying there's nothing that's healing. Um, uh, the There is no reason to think that the appropriate physical therapy cannot help you in some way. Um, I'm doing a study right now with people with really severe MS, people who are wheelchair bound and can barely transfer, and I'm giving them aggressive therapy every day, or not, excuse me, a couple times a week, and they're showing improvements. So I'm when I hear nothing is getting better, I get very skeptical. And maybe you might want to ask your PT to give me a call so we can discuss your case. Yeah,
Thank you.
let me get on that soapbox for a minute, Deborah, if you don't mind. Um, I get calls a couple times a week from PTs trying to figure out how to work with their MS patients, and I love that. Um, I don't charge for it, at least, not at this moment, but and uh, I think there's a lot of knowledge out there about how to work with people with MS, but it's hard to access it. And if you want your PT to contact me, they can do it directly through the MSF. I'm more than happy. Um, uh, about a year ago, I was speaking with people from Canada, from Saskatchewan. I've spoken with people from all of the United States, from South America. I am ready and willing and able and want to. So if you want your PD to give me a call, this is what I do. I teach MS, and I'm happy to do it.
Yep. You can actually, for anybody that needs their PT to speak to Dr. Karpatkin, they can, do you have a letter or an email that we sent you reminding you of this conference? That's our email address that you can respond to, and then we'll get the information to you. So it's the easiest way. The next one is quite lengthy, but I think she has some really interesting
Okay, good.
aspects. So Tracy said that she has a 20-year-old son who was diagnosed with relapse remitting about 2 years ago. He was also diagnosed with something called FND, and that his
Functional functional
hi-
neurologic disorder.
his symptoms are mainly from the FND. Since being diagnosed, he hasn't done much. Before all of this, he was super active in sports, etc. Now he barely does anything. He's still living at home. He isn't working. He isn't going to school, doesn't have a job. So, what do you recommend as a parent how to get him to do anything? He is very smart and fit guy, but as a parent and having heard some of the things I have researched, I just feel he should be able to do all the things he used to do. Do you have any suggestions on how to navigate him doing more and what we can do? I'm just worried by letting him figure this out on his own terms, we're doing more harm than good. I try to get him to watch these Zoom calls, but he doesn't like it. Let's see, but he doesn't make it a priority. Are there counselors out there that are specific to MS? I feel in our area there doesn't seem to be any resources for families for those with MS.
Well, from what you're describing, it's hard to tell whether it's MS or FND or the interaction of the two of them. I'm not a specialist in FND, although I know a lot of people who are, but I think the decision has to be, or the information has to be uncovered which one it is, because those are two very distinct conditions. There are FND specialists, um, particularly physical therapy specialists. And if you get in touch with me, which you can through the MSF, I can try to find ones in your area. But FND is a very different animal from MS. And there is good evidence that it could be successfully treated, but you have to, as with everything else, you have to find someone who knows what they're doing. If the MS is a big issue, I can once again help you find an MS specialist in your area. But from what you're saying, it's MS and the FND and the interaction of the two. But if you let me know where you are, I will try to find someone who can help you. Absolutely.
Thank you. Linda would like to know if you have any thoughts on the addition of motorized range of motion to an exercise program, especially in the winter time.
Motorized range of motion. I'm assuming you mean like passive range of motion. Um, for patients who are unable to move otherwise, it's not a bad idea. Um, uh, movement is always better than not moving, but if you can move on your own, you're better to move on your own than letting a machine do it for you. That being said, I've had many patients who use passive range of motion devices. They go by different names, continuous passive motion. There's a device called the MotoMed, FES bikes, and they all have the advantage of, in people who wouldn't move otherwise, it's good to have it. Because again, movement is always better than not moving. But it's also better moving under your own power is always better than not moving under a machine's power. So it's not a bad thing. Um, I guess from the way you asked the question, one worry that I have is if you stop moving, in the winter and use the machine instead, that means you've stopped moving for a season, and that will certainly make your MS worse. Movement is one of the best, movement under your own power is one of the best medicines available for MS. But the problem is, just like medication, if you stop doing it, it's going to stop having an effect, and it's going to be that much harder to get that movement back.
Thank you. Laura says that she's heard the recommendation to exercise 150 minutes per week. How much is too much? I go to the Therapool 3 times a week for an hour at a time. Then I also go to our home gym an hour on the nights that I'm not there. Other than that, some days I'm just too sedentary, but I have so much hip pain, it's hard to be up and about. So, how much is too much?
Um, there is no way to possibly answer that question. Uh, I think obviously if you push yourself so hard one day that you can barely move the next day, that's too much. I think the 150 minutes a week is a sort of gross generalization. Um, some people I work with would have a lot of trouble doing that much. Okay. Some people that would barely be a drop in the bucket for them. I think it's not just the time though, it's a couple of other things. It's the time, it's the intensity. How hard are you doing the exercise? It's the type of exercise. Are you doing, 150 minutes of brisk walking or 150 minutes of wiggling your fingers? So there's a lot of variables in here. Um, I've had some patients improve significantly on 10 to 15 minutes a day of very specific and very aggressive exercises. I have some patients who do 300 minutes a day, but it's of exercises that aren't of much use to them. It's important to know that not all exercises are the same, in the same way that not all medication is the same, not all exercises are the same. So I think it's important to take into account not just the volume of exercise that you do, but the type of exercise and how intensely you perform that exercise. You should use your own fatigue as a gauge of how much to do. If you do a certain amount of exercise on Monday and on Tuesday you're too tired to do anything, that means you probably did too much on Monday. 150 minutes is not a lot. That's pretty much 20 minutes a day. You do 10 minutes in the morning, 10 minutes in the afternoon, and you're there. You do 10 minutes of stretching in the morning and then 10 minutes of balance work in the afternoon, and you're done. That's not, to me, a tremendous amount. It does suggest that you work on it every single day, though, which is what I'm a big fan of.
Thank you. Someone is asking, when does the cooling program start accepting applications? And that is February 1st. For the foundation. We try to get the applications in early and then we stop it on June 1st because we want everybody to have their items prior to it getting really hot. So that's the theory behind all of that. um, let's see. Jim says he gets spasticity in his calves to the point that his toes curl under. He has found that massaging connected muscles, thighs above the knees, can cause tightness to relapse. Your thoughts on working opposing muscle groups?
Um, Working the opposing muscle groups has been tried a lot for people with spasticity with at best mixed results. I think the two best things for spasticity is one, if you're not on medication, you should be, and you have to speak to your neurologist about it. There's a very well-used medication for spasticity called baclofen. And if your spasticity is anything more than mild, it's worth talking to your physician about it. The other thing is, if your toes are curling already, that means the spasticity is probably on the moderate to severe side, and you must start stretching out your calf muscles. You should be spending a few minutes a day working on stretching out the calf muscles, or the spasticity will just take over the movement in your foot and you won't be able to uncurl your toes or relax your calf. The massaging of the muscles above the knee, I can't see having any kind of an effect on it, any kind of positive effect.
Thank you. Do you have any recommendations to improve balance?
To improve balance,
Hmm.
do I have recommendations for you? So yes, of course I do, and it's one of the main reasons why people come to see me. Um, Let me start by saying the most important thing you can do to improve your balance is to work on your balance. Now, this sounds very simplified, but in MS, I can't overstate its importance. The reason I see why a lot of people with MS lose their balance is because they notice their balance getting worse. They move less. They stop putting themselves in situations where their balance is challenged. That makes their balance worse because they've stopped practicing balance. So that is the result of them stopping their movements even more, which makes their balance worse. Without examining you, I can't tell you what type of balance exercises to do, but I can make a general statement like this. Try to find a standing position that is challenging but not impossible for your balance. For some, that might just be standing with your feet close together. For some, that might be standing with your eyes closed. For some, it might be standing on one foot or standing on a soft surface. But find a position which is challenging but not impossible for you to be in, and then spend a lot of time in that position. To put it more simply, find what's difficult and do that. Not impossible, but difficult.
Hmm. Do you have any suggestions about exercises for knee hyperextension?
When you say knee hyperextension, what I'm assuming you're talking about is your knee is snapping back when you walk. That's called an extension thrust, and that's fairly common in MS. what is usually the cause of that, even though this is a little counterintuitive, is tight calf muscles. Okay, the tightness of the calf muscle makes the knee snap back sooner. So what I recommend you do, even though again it sounds a little counterintuitive, is instead of working on your knee, excuse me, try to stretch out your calf muscle as much as you can. I've had very good success with patients who have that hyperextension, extension thrust of the knee. And by working on their calves and not on their knee, that improved.
And this person is, I believe the way they wrote it is, I'm going to say it a little differently, but basically, do you suggest that someone goes to physical therapy at least once a year for just helpful tips in mobility for a person that has MS?
Um, I think if you have MS, you should be seeing a PT regularly. Um, I have many patients who I've been seeing for, 10 or 15 years. Originally, I would, when I first see a new patient, I might see them once or twice a week for a few weeks, and then it goes down to once a week, and then maybe once or twice a month, and then every 3 to 4 to 5 months. And they just keep checking in with me if they feel like something is getting a little bit worse. Uh, they'll call me and I'll come and check it out. I literally saw a patient last week who I had not seen in a few years because he moved to another continent. But when he was back in New York City, I saw him, and there were a few small changes from last time I saw him, and I was able to help him with it. So PT should really be a lifetime thing for you if you have MS. It doesn't mean you see a PT every day for the rest of your life. After you're worked in with one, it's probably don't need to do it more than 2 or 3 times a year. But doing the PT exercises every day is important.
Great, great suggestion. So, Shelley said that due to hyperextending her left knee, it's presenting yet another set of circumstances, in addition now to a weak leg and poor balance. She's experiencing sharp pain as well. Is this now a PT issue or an orthopedic issue?
It's an orthopedic PT issue. So the you have two issues if you're hyperextending your knee. One is that because presumably of tightness in the calf muscles, you're losing knee control, so the calf muscles have to be stretched out. The pain in the knee, presumably from constant fast hyperextension, has to be seen by an orthopedic PT specialist. In the same way that I'm a neurologic specialist, there are PTs who are orthopedic specialists. And they uh, will be able to do an examination of your knee and help you with the pain. But the more important thing is to find a way to stop doing the thing that results in pain.
Hmm, that's smart. Kim says, do you recommend a specific shoe? Because she has nerve pain in her feet, so tennis shoes are just unbearable. Do you have any suggestions?
I'm not sure what you mean by tennis shoes. A shoe that's too tight is going to be pretty uncomfortable no matter how much support or cushioning it gives you. Um, Same time, you don't want it to be too loose because then your foot slides around in it. Um, I generally will recommend for my patients a shoe with a relatively firm upper to hold the top of your foot in place, some significant cushioning underneath to absorb the shock, and that is not a very tight fit.
Laura says that this year she started going to a local TheraPool 3 times a week, and it has been great for her strength and condition. They have a lot of great pool toys around the perimeter. Some. What are some exercises I can that she hasn't thought of? Is it too small and crowded to really swim? Um, it is 92 degrees in the water and 90 degrees air temp. Feels great. and she says that she's in better shape 9 months later. Any more
Well,
ideas?
first, that's great, that you're feeling better because of the exercise. Um, I don't know what exercises to recommend for you because I don't know what exercises you're already doing. Um, what I can give you a few general guidelines. First, try to do in the pool what you have trouble doing on land. Not a big fan of swimming, not because swimming's bad for you, but if you practice swimming, you're going to get good at swimming. And swimming is not really your problem. I would rather see you doing lots and lots and lots of walking in the pool, or balancing on one leg, or moving your arms against resistance of the water. The most important thing, though, is to keep your body moving. If you're in the pool for an hour a day, if the pool allows you to move without stopping for an hour, that would be amazing. I would urge you, if you want to know what to do, practice the functional exercise. Walk forwards, backwards, sideways, in sharp turns, in wide turns, uh, with your eyes open, with your eyes closed. Walk in as many different conditions and situations as you can.
Thank you. Do you know if baclofen and magnesium supplements can be taken together?
Question for your doctor. I believe so, but I don't know for a fact, but that's an MD question, not a PT question.
Okay, and Joe says thank you, and he's the guy in the wheelchair you described in your study.
I in the wheelchair I described in my study.
That's what he said.
Well, Joe,
Okay.
if you're in New York, you should come by and enroll in my study.
Casey says, hello, I'm 64 and diagnosed with primary progressive 10 years ago. It continues to progress. Hand strength and dexterity, when a little torn out, continues to decline. Would like to exercise my way out of decline, but don't know MS PT specialist in my town. Thoughts on how to create a program? Thank you.
Um, Again, hard to say because outside of the problems you said you have with your hand, I don't know what's going on. If you want to contact me, I will find PTs nearby for you, which my friends at the MSF will tell you I do a pretty good job of. And or if you just want to try to talk with me over the phone, um, if you can't find somebody, I will give you some ideas on what to do over the phone.
Thank you.
The main
Lo-
thing for the hand, let's talk about the hands for a minute. Couple years ago, I worked with this absolutely lovely woman, um, uh, who the MS wasn't impacting her that much except for her hands. And when she came to see me, she said, it's bothering my weakness in my hands is bothering me so much that I've given up playing piano because I can't stand uh, what I sound like. And then she said, but uh, that seemed to make my hands worse. And I told her, that's because you stopped playing piano. The movement that you put your hands through on the piano, even though it's disheartening, is actually one of the things that kept your hands as good as they were. It's the stopping of the movement that causes as much of the problem. So if your hands are giving you trouble, the most important thing you can do, in my opinion, is to make sure you keep working with your hands because they will get worse a lot more quickly.
Thank you. Connie says that over the past couple of months, she's been having a lot of difficulty getting up from a stooping position, even with a counter or something else to try to pull herself up. What specific exercise can help with that?
Well, I'm not sure what you mean by a stooping position. I think you probably mean like a crouched position or something like that. Um, Again, without seeing you, it's hard to say, but here is probably how I would start. In this exercise, you would stand straight and tall, go into a really partial crouch, maybe 25% full crouch, and come back up and just work in that short range. Okay. Once you've gotten stronger in that range, keep adding every couple of days a little bit more uh, depth to the crouch. Okay. But again, don't stop crouching. Okay. That will guarantee that it will get worse.
Thank you. Jim says that he's on baclofen and tazidine, and he does do stretching. So
So,
you must have.
say again.
Jim said that he's on baclofen and tazardine, and
Vanadine.
he does stretch.
Okay.
So I think that was related to a previous question that you had answered. And
Okay.
so it's not all together, so it's not quite making sense, but I believe you
Oh,
answered his
no,
question.
I remember the question. So my next question would be, how much do you stretch? And that's a really important point to bring up because, a lot of times I'll give a talk and someone will say, yeah, that stretching doesn't work. I stretch and it doesn't help at all. And I ask them, how much do you stretch? And they say, oh, like a lot, 1 or 2 minutes every day. And I'll say, well, if you stretch for 2 minutes a day, that means for 23 hours and 58 minutes a day, your feet are not being stretched. That's not enough. So again, you remember I said at the beginning of this talk that exercise is like medicine. So sometimes medicine has to be taken in a specific dosage. And if you don't exercise enough, it's as if you're taking the incorrect dosage of medicine.
Hmm. I believe this one is regarding her other question about working in the pool. She said with hip pain, Laura says, and the hip replacement, she certainly can't walk swiftly, obviously, but she can do more in the pool at less gravity as
Right.
there is less pain. So, as far as any fatigue, she's never been the type that doesn't recover overnight, but her fatigue is motor fatigue. So, she wants you to know that.
Okay. Um, Again, the pool gives you an opportunity to exercise for a longer period of time. So you should take advantage of that.
Mhm. Are you familiar with OsteoStrong, which is a system using robotic muscular skeletal treatment that allows axial compression of bone? In other words, osteogenesis loading forces. Do you think this would be beneficial for MS?
This is the first I'm hearing of it. I'll look it up right now. Osteo Strong.
Mhm.
Let's see.
A system using robotic musculoskeletal.
Osteo Strong.
A
Looks
cool
like
name.
it looks like a franchise. A biohack that uses osteogenic loading to improve bone density, posture balance, and athletic performance. Quick, painless, measurable. I mean, it's a good sales pitch. So in terms of improving bone density and bone strength, any exercise that has you do weight bearing is going to improve bone density. Okay. Um, does OsteoStrong offer anything specific beyond that? I have no idea. It's the first I'm hearing of it. I'll look it up right now. But but if they offer an easier or better way to gain the benefits of increased bone density, it's worth looking after. But I have to put in a caveat about that. I, I've been specializing in MS for 25, 30 years now. And it seems like every year or two, some new gadget gimmick technique comes on the market that says this will help your MS. And they all, last a few months and then they go away and then something new comes up. Um, it's not like I'm trying to pick on anybody or, stifle business or creativity. I want these things to work. I want, if biohack helps MS, then hallelujah, go for it all out. But on the other hand, there are, I know it's hard to believe, dishonest people in the world who look at people with MS as a nice ripe victim. They said, oh, these people are desperate, I'll take anything. And I've seen this far too often, and it's vile and despicable, but it's out there. Um, and there is such a thing as science, and the treatment of MS should be based on scientific principles. And science means that it's provable, and it's proven in research, not by anecdote, not by, somebody saying, well, I know someone who tried it and they did much better, so therefore use it. No, no, that's not how this should work. You should rely on science. This is why I do so much research. I want to be able to tell people we studied this type of exercise program and we found positive effects for it. And so I can feel very confident that when I prescribe it, it's going to be good. When I see the biohack and I see, we have centers opening up everywhere, yeah, it makes me a little bit suspicious.
Hmm. Barbara says that her right hip flexor is stuck and she can't bend her leg to the right when she's sitting without using her hand to move it. If I sit too long, it won't move to stand up without help from my hand. My MS doctor says PT will be good overall, but won't help with the hip flexor problem. She's
Well,
asked,
again, without seeing you, I don't know. With all due respect to your doctor, I think he should probably let the physical therapist figure that out, and so, instead of himself or herself. Um, the one important difference between PTs and MDs is PTs are trained in PT and MDs are trained in medicine. So I've studied PT for, I got 3 years undergrad, close to 40 years clinical experience, and 7 years of doctoral work. So I feel I'm pretty qualified to make judgments about what PT works and what doesn't. On the other hand, I didn't go to medical school, so I'm not going to make a lot of judgments as to what it's appropriate for a physician to say. I would like a physician to show me the same courtesy. Um, uh, it happens to me a lot that I'll see a patient after the doctor said, well, there's nothing therapy can do for you. And then the therapy is incredibly helpful to them. And, the patient would say, wow, I had no idea. And at first I think, well, that's so cool because I'm just such a wonderful, groovy physical therapist. And actually, that's terrible because it means the doctor had no idea what he was talking about, what he or she was talking about. So I can understand why some physicians might think that PT is ineffective because the PT that they went to may not have had training in MS. And that's why it's so important to find PTs who are trained in MS. In the same way that for your MS, you go to a neurologist who's trained in MS. You wouldn't go to, a dermatologist who's, trained in acne. If you went to a dermatologist who was trained in how to treat acne for your MS and it didn't help you, you certainly wouldn't think, well, medicine doesn't work. No, you went to the wrong doctor. So um, it's a pet peeve of mine. Um, I and my colleagues put an enormous amount of time into working with people with MS and studying it and trying to figure out what's right. And it's very, very, very unusual when we find a patient who we are unable to help.
wonderful advice. It's so obvious that you love what you do. It just literally flows from you, which makes this every other month session like one of my favorites.
Well,
So it literally
I,
just it flows out of you with everything that you say. So thank you so much.
well, I am so grateful to the MS Foundation for putting this together. I think it's, You guys do so much amazing work, but this is one of the best things you do, I think, in a whole slew of amazing things. But you have this mission to bring information to people with MS. And there's other good MS organizations, but none of them are as focused as the MSF on trying to meet the immediate needs of patients with MS, not the needs of the scientists or the healthcare administrators or anything else, but what do the patients need to get? And that's why I keep throwing in my lot with you guys, because as far as I'm concerned, you get it. I mean, you
Thank you.
know,
Them as the educational programs coordinator, it makes me so happy to hear that because
oh, well,
truly, I go home talking to my husband at dinner over this. So, it is our mission to educate everyone and to bring them the most up-to-date information and to make things meaningful to people. We want it to be meaningful. So, we do have just three more questions. I think we can get
oh,
through that before you have to leave. So, Sharon wants to know, do you think a vibration plate can help?
oh. So a few minutes ago, I was talking about what's the latest thing. Um, Vibration plates were the latest thing for a while. They were studied in MS, and there was no evidence that it offered anything special. When I had my own private outpatient practice, I had a vibration plate, and so for some people they liked it, and some they didn't, and I didn't notice any difference. Um, it's a I describe it as a modality looking for a use. Um, the thing that works the best, in my opinion, for people with MS is the following. First, move. Movement will always be better than not moving. Second, there's something that is referred to as task-specific practice. And what that means is you get good at what you do and you get bad at what you don't do. If your walking is getting worse, then you should be practicing walking, not biking, not swimming, not yoga. There's nothing wrong with those things, but why would you think that practicing biking is going to improve your walking? It's as if you're trying to improve your guitar playing by practicing the clarinet. Why would you think that would work? The body works the same way. So the very basis of physical therapy for me, for not just my MS patients, but all of my patients, although most of my patients are MS, is that find out what you're not good at, find out what you're struggling at, and practice that a lot.
Great information. Somebody said that they hyperextended their knee because their knee buckles. Would that be caused by tight calf muscles?
Yes, stretch your calves. A
Okay,
lot of times when they see that happening, people can understandably think, well, that's a knee problem. Actually, it isn't. I mean, there is some weakness in the knee which causes it, but it's really much more of a calf issue.
wonderful. We have a couple more minutes. If anybody has another question, we do have a bunch of thank yous. They think this talk has really helped them. So
Well,
thank you, thank you.
thank you
Um,
guys right back. And
yeah,
thank you, MSF.
if we have any other questions, this is the time. Otherwise, nope, more thank yous. So I guess you've done a great job in
Don't
answering
be afraid. Don't
everybody's
be afraid to
questions.
reach out to me, guys, if I can help you find a practitioner in your area.
Yeah.
I'm, I would absolutely love to help you with that.
Great. So now that does bring us to the end of our time. If you've missed any part of this conference, it has been recorded, as all of them are, and it will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email that I mentioned a little earlier for information on how to access any of the recordings or to sign up for our newsletter, which will tell you about the upcoming events. Also, you'll be receiving a short survey when you leave the conference. We'd greatly appreciate your feedback, which helps us determine what types of information is most meaningful and helpful to you as the attendees of the conferences. So our next teleconference is this coming Tuesday, well, actually not this coming to the November 11th but it is a Tuesday at 3 o'clock p.m. Eastern. We'll be having a panel of 4 individuals who are all over the age of 60. Many of them are older than that. And they're going to be telling you what it's like and how they've made MS better for decades. They've been living with MS for decades, and they're going to tell you their experiences, how they've lived well with MS. So it's really, we're super psyched about it. I love patient panels. I love when they get to talk amongst themselves and share that with all of you. So my goal this year and next year is to have more and more patient participation panels. Our sincere thanks to all of the attendees for your participation, and especially to Dr. Karpatkin, who continually, time after time, comes in, his busy schedules. He's still here, and he educates all of us. So thank you for that. Goodbye, everyone, and we'll see you next time.